Dr. Dave Smith is our next speaker. He's going to be speaking about field epidemiology to manage BRD. Dave is an endowed professor and BEEF program leader at Mississippi State University. Well known, he's spoken at multiple national meetings, regional national meetings on really practical applied epidemiology. So with that, I'll turn the floor over to Dave and here, listen to what he has to say.
All right. Thanks, Dale. Does this sound all right? You can hear me back a little bit too loud. So first of all, I'm really honored to have an opportunity to speak at this symposium. This has been fantastic. I'm just thrilled to have a seat in the room because the organizers have done a fantastic job of putting this together. I've been thinking through this meeting over and over again. It keeps coming back to me that we're talking about the fundamentals of medicine. So there are some fundamental things that we learn in medicine. First of all, differentiating normal from abnormal. We have a challenge doing that with BRD, interestingly enough, right? The next thing we do is we start to look at patterns, right, of occurrence. So the patterns, there might be different events, things that like presence of lesions, presence of clinical signs, behaviors of the animals, behaviors of the people that are working with the animals. And we try to sort those things out. We look for patterns related to time, place, the subject, right? And so we're trying to classify those things by those categories, hoping that we can identify some factor in the system that seems to be going wrong that's leading to this undesirable outcome, which might be BRD in our case. So the system, that might be the respiratory system, that might be the immune system, might be the neuroendocrine system, it might be the livestock production system, it might be the beef cattle marketing system, right? There's all kinds of levels of systems that might be coming into play that are leading to these outcomes. So we do all that, and it doesn't really matter. That's the process that we take, whether we're examining an individual patient, or it might be the same thing that we're doing when we're examining a herd or a population that's having some problem. And so that's what we call an outbreak investigation. Let's see if I can make this work. I guess I can. Is it the other button? There we go. All right, good. So what I'm really going to talk about are actually in the proceedings. I've got a lot more information about outbreak investigations. That's kind of the subject of what I'm going to talk about. I mentioned systems. I'm going to talk about systems tomorrow in the ABC meeting. And this presentation is really about using field investigation to understand risk for BRD. And I'm going to talk about BRD in calves prior to weaning. And we haven't spent very much time talking about that particular problem. We know that respiratory disease is hugely important to the cattle industry, highly economically important. Deaths alone cost producers over $643 million annually. I've been trying to figure out what that number is for pre-weaning pneumonia, and I could use some help from the group, actually. If you've got some thoughts on this, I'd like to know. I've come up with kind of this is just a back of the napkin kind of a calculation, but maybe $290 million, and that's $10 for every cow in the country. Since about a fifth of the herds in the country have problems with pneumonia and BRD, that might be $50 per cow in those affected herds, and some of those herds are really severely affected, and so it's a lot more than that. The challenge with coming up with these numbers really comes into, so what's the value of a calf that dies at a young age, and what's the treatment cost? Treatment costs are hugely variable for operations, and it includes some problems like trying to figure out, well, they could have been doing something else with their time, so there's some opportunity costs there as well. Okay, so we're talking about pneumonia in calves prior to weaning. All the time through this session, we've been talking about stressors and commingling, and these calves aren't having any of that. Right? So how do you explain calves getting sick with pneumonia out on green grass and sunshine with their moms? So I think that the things that we might learn from these investigations tell us a little bit of something fundamental about the susceptibility of calves to respiratory disease. And while a lot of people, we've heard a lot of information about those things that are going on inside that calf, those host pathogen interactions, I've been kind of interested more in, well, what else is going on? So that calf is having something going on, some failure that's leading to respiratory disease in its own body, but what's going on around the population? So who else is sick, and why are they sick, and how is that influencing this calf's illness? And so we know that these processes, involve these host agent interactions, but also what's going on in that calf's environment, and those things change dynamically over time, so that from year to year, and this is data from the U.S. Meat Animal Research Center, looking at incidence of respiratory disease in their herd over 20 years. So there's about 110,000 calves represented here, and their rates of BRD are quite different from year to year in their pre-weaned calves. All right. There's lots of things that go on in those operations that occur within a season that also are highly variable and have a huge impact on whether respiratory disease takes place or not. So really, I think the challenge is to understand what's going on across time related to the immunity of the calf and its exposure to these various pathogens. And I'm not going to say very much about the pathogens because I really don't understand it, and I don't think very many of us really understand what's going on in terms of pathogens in pre-weaned calves. In fact, I've spent a good bit of money trying to answer that question and mostly wasted it because we did PCR in samples where there had been modified live virus vaccines used in the herds, and so when we were done, we probably weren't sure what we'd found and what was real and what was vaccine virus. So, pay attention to those things. I've used this diagram when we're talking about calf scours. I use the same diagram. This idea that colostrum antibodies wane over time, and it takes some time for that calf to develop a good, strong, active immune response. And so there might be some period of time in there when that calf might be particularly susceptible to infection. And so if you believe Jim Roth at Iowa State, which I do, he suggests that the half-life of antibodies from colostrum is about 16 days. And so that means that whatever that calf started with, by the time that calf is 90 to 100 days of age, those antibodies are gone. Right? And so it doesn't really matter how high that level was. They're pretty much gone by the time that calf is 90 to 100 days of age. So if you were trying to have an impact on calf health, BRD health, by modifying colostral antibody levels, you can probably have some impact in the first 60 days or so. Right? That's probably pretty important, how well that calf mothers up, ingests colostrum, and so forth. By 90 to 100 days, that probably has minimal impact anymore. And it takes 5 to 8 months for that calf to develop a strong, active immune response. So I'm going to use some data from our previous speaker. So this is some research that's DL conducted and published looking at what they were looking at was antibody titers elicited from either vaccinating calves at about branding time or at pre-weaning vaccination. So this is what the serology looked like for IBR in those groups of calves. So it's looking at the titers as those calves got older and older, so from up until 250 days of age or so. All right, so you should see that antibody titers decreased. There was really not much. When they finally had a response, which is sometime after 200 days, a measurable antibody response, didn't really matter whether they were vaccinated at 67 days or 167 days. I just really want you to focus on the idea that those calves from 100 to 150 days, maybe to 200 days, really are at low humoral antibody titers. And that was true for all of the viruses, right? So it might make sense then that if those humoral antibodies are responsible for protecting those calves from exposure or from infection, that those calves might be susceptible to all of these viruses in that range of age, between 100 and 200 days of age. And that's probably why this data looks the way it does. This is incidence of BRD by age in days for about 15,000 steer calves. These are steer calves that made it all the way through to the feedlot, so they survived through the feedlot at the U.S. Meat Animal Research Center. And that's about 14 years of data combined. But the highest incidence in those age groups was between 90 and 120 days of age. You might guess that the incidence is lower prior to that because of the protection from maternal antibodies. And it's, did I say that right? It's lower prior to that because of maternal antibodies, and it's lower after that because of an active immune response by the calf. We've been investigating outbreaks of respiratory disease in ranch calves in Nebraska, and so I'll show you a few of the findings from those herds. First of all, I want to point out, this is pretty low-tech stuff, particularly compared to what we were listening to this morning. That's purposeful because I want to point out to you, the practitioners in the room, this is all stuff you can do. I'm not going to show you a graph that isn't anything that you couldn't do in a spreadsheet, and I can show you in a few hours how to do these things. Challenge that you all have is getting the records. The data is pretty sparse. We've got a case control study going on where we're trying to identify case herds. Within those case herds, if they've got data that we can use, we're trying to generate this type of information. And it's about 1 to 10, isn't it? About 10% of the case herds that we're working with can provide even the most basic data, right? Just birth dates, when calves got sick. So it's a challenge for us to get our hands on the data. So here's a ranch that had about a 30% cumulative incidence, and you can see that they started getting sick when calves were about 110 days, and it was all over with by the time the oldest calves were about 180 days or so of age. Here's another herd, a few calves that got sick when they were really young in the first 2 weeks, and then calves started getting sick when they were 100 days of age, and it was over with by the time the calves were about 200 days of age. Here's the exception to prove the rule. So this ranch really didn't complain about their respiratory disease. We just had access to their data, so we used it. This ranch had a low incidence of BRD, and you can see that their biggest problem was in calves that were less than 60 days of age. They also had some of those calves older that got it, but their major problem was younger calves. So this is another pattern that we see in some herds. More problems with sporadic cases of calves with BRD less than 60 days of age. All right, just to make the point, here's a few more. Here's another ranch. Few calves at a young age. Most of them were occurring when the calves were 80 to 150 or 60 days of age. Repeatedly and repeatedly, we have this age range when calves get sick. And finally, I don't know if anybody else noticed it, but for the last couple of years, it's been really dry in the plain states. And so a lot of people were early weaning their calves. And so here's a herd that in 2012, they early weaned their calves. So the bars in red represent the counts of calves that had BRD before they were weaned. All the black bars represent calves that were weaned when they had BRD. So again, you see there were some calves that were young, less than 60 days of age, that got sick. Most of the illness, again, occurred when calves were 120 to 120 days of age. That data looks a lot like what the U.S. Meat Animal Research Center has experienced. So I showed you this data before, but here's the distribution of the incidence of respiratory disease in their herd over the 20 years from those 110,000 calves. And so it has that same pattern. Some calves get young Some calves get BRD at a young age. The majority of the calves get sick in that 100 to 200 days range. And the authors noted that while there's kind of an increasing rate of illness in the first 20 days, and then it goes back down again, and then it comes back up again at 75 to 100 days or so. And they speculated that, well, what's going on here, these calves that we're talking about that mostly get sick, they said between 75 and 170 days of age, that's probably because of ranch management practices where they're bringing cattle in together because of breeding practices. Well, so it's a reasonable suggestion that there might be some management practices like that convene to increase the risk. I'm going to suggest another hypothesis, and that is that it might be related to herd immunity. So you remember about herd immunity, that's when the majority of the group is protected, and because the majority is protected, it prevents the pathogen from circulating through the rest of the group, even though there are some susceptibles in the group. And this is the goal for most of our vaccination strategies. We're trying to achieve, when we vaccinate calves, to achieve some level of herd immunity to prevent transmission, even if we don't get 100% of the calves immunized. So I'm just going to illustrate that. This is data from Dr. Amelia Woolam's, and so they did a study where they were looking at BRSV titers. So there's 180 calves here, and these are distributions of the titers based on the ages of the calves. So they just followed the same group of calves over time. So at 2 days of age, you can see that there were titers as high as 1024. Dr. Woolam suggests that titers above 1 to 16 are protective. So to the right of the line, those represent calves that are protected. On the left side of the line represent those calves that aren't. As those calves get older, so when we move to 56 days, there's a shift. They're losing maternal antibodies. More and more of that population has lost their protection against BRSV. By the time they're 117 days, you can see that the majority of the population is now susceptible. That's a population that, if there is pathogen exposure, you might expect that suddenly it has a very susceptible population is able to spread. So the analogy that I would use is that in my home in Mississippi, I'm not sure you can do that here, I can walk out in my front yard in March and toss a match and nothing's going to happen. And I can probably do that in April and May. And I might get away with it in June, but if I do that in July, I'm probably going to start a grass fire, right? Because the grass has become increasingly susceptible to that fire. All right. So looking at the same data from the same ranches I've showed you earlier, this is now an epidemic curve. So it's just simply the numbers of cases by time periods. And so here's herd 1. This is a May calving herd. Their problems occur in October. And so you can see the numbers of cases, and that this kind of happens suddenly. These aren't sporadic cases here and there. There's an outbreak, and the lines represent the proportion of the herd. That is, the top line represents the proportion of the herd that are 100 days of age or more. The bottom line represents the proportion of the herd that's 120 days or more. So that's about the time they're losing their protection from colostral antibodies. And so when that proportion gets high, 80% or so, suddenly we've got sick calves. Second herd, same thing. So here's the eventual epidemic and the proportion of calves that have lost their maternal antibodies. Third, this is herd 4. Here's that herd that did the early weaning. So they early weaned, and you can see where those cases occurred. But by September, those calves were all weaned, and you can see again that really when the outbreak took place, it wasn't immediately right at weaning either. It was when they were age susceptible. Does that make sense? That's a really important thing, that they didn't break at weaning. They broke when the herd was susceptible. Okay. We combined some of the data from the ranches together. If we could do that, adjusted for the herds and the management groups and so forth, and accounting for those things, bull calves were more likely to get sick with BRD than steers, and steers were more likely to get sick than heifers. So there was a gender effect, and that's been something that's been noticed in other species. Men are more likely to get respiratory infections if they're hospitalized than females, for example. So it's interesting that we found that in the calves. This is a relationship that you might expect. So if the calf's mom was a 2-year-old heifer, that calf was at higher risk than if the calf's mom was a 3-year-old, and there was higher or lower risk if the dam was older than that. So probably related to risks for dystocia, mothering ability, some of those things. All right, so the conclusions that we've drawn from these outbreak investigations of these Nebraska ranches, that there are calf-level characteristics that explain the risk for BRD. Age of the calf affects their risk. Age of the dam affects their risk. The gender of the calf may affect the risk. And then there were these herd-level patterns, right? So that we saw 2 patterns of occurrence. We either saw sporadic cases of BRD in young calves. Probably, I'll speculate, it's related to failure of passive transfer. Those are calves that didn't get their dose of colostrum early on and were particularly susceptible. And then these large, sudden outbreaks in older calves that I'll speculate is related to the loss of herd immunity. Okay, so I guess that explains that. So the application of these findings is, I think we might be able to manage BRD risk by addressing age at vaccination. Right? So we may be able to develop a vaccination program that gets these calves protected before they're in that window of susceptibility, which is that time period between 90 and 200 days of age. We might be able to manage it by thinking about age of exposure. So possibly making sure that we commingle those calves if there's going to be something going on. We do that at either an early age, prior to 90 days of age, or we wait and we do those things, after 200 days of age. Or we think about how old they are when various stressors take place, like weaning. All right, so probably the worst time to wean a calf is in that inherent window of susceptibility that they seem to have. So we should either wean early or we should wean late. And there's good, at least anecdotal evidence to suggest that early weaning calves have less trouble with BRD than calves at more conventional weaning times. This is the way, I don't know whether it's appropriate to mention pigs at this meeting or not, but the swine industry has exactly followed that. So they do early weaning so that they can manage those risks while that little piglet is protected by maternal antibodies. There are some barriers to progress that I've heard over and over again at this meeting. One is we need better methods to characterize the disease process, and we've heard other people talk about that. We need a better case definition. We need better diagnostics. We need to be able to capture data on farms. I think a lot of practitioners could do your clients a great service if you could help them get on a data collection system so that you could help them evaluate evidence-based, did this help your herd or not? Where are you at? Where do you want to be? I don't know how people move forward if they don't know where they're at currently. We need to be able to characterize the immune status of individuals and populations better than we're able to do right now, and we need to be better able to characterize the pathogen exposure of individuals and populations. And so we have a number of challenges before we get this worked out. Let me thank my various colleagues and coworkers that have helped with these outbreak investigations. This work has been supported by Zoetis. And with that, thanks. I appreciate your time and attention.